COVID positive in these hallways. All you hear is oxygen.
Streets are empty. Small businesses are encouraged to do their part to keep their employees, customers, and themselves healthy, even resulting in closures. Some are even fighting on the front lines in efforts to prevent the spread of COVID-19. Citizens are asked to wear face masks and self-quarantine.
I mean, this sucks, but at least I'm home.
Today, I'm asking you what it would be like to be in a prison cell during the coronavirus. But then I thought, I might as well show you.
All good like a couple days ago, right? So, all of a sudden, out of the blue, fucking everybody just fucking dying and getting sick and shit. Like, this shit serious as fuck. Like, they literally leaving us in here to die.
Like most during this pandemic, you should be scrambling for everything that you can control. Food, supplies, care for family, and distance. But as a prisoner, you are powerless.
They talking about social distancing and shit. You feel me? Nigga can't even social distance and nothing. This motherfucker over here dying from corona. They got this motherfucker in my room and shit. You know what I'm saying? How the fuck I'm supposed to live? You know what I'm saying?
So, how are prisoners supposed to deal with this virus? They don't have access to their own food, shelter, and let alone distance. And with little advocacy, these inmates are left in cramped and unsanitary conditions that are a perfect place for the virus to spread. During normal times, the legal system would assume that the surest way to minimize risk to an individual or their potential risk to the community is to keep them in a cell. But in the face of COVID-19, we must acknowledge that the risk of death inside prison walls has become higher than the risk of releasing most people. As many as 100,000 incarcerated people will die from the coronavirus unless the United States acts now. I urge all of you to contact the elected representatives in the Department of Corrections wherever you live in light of this pandemic. Law enforcement should identify those who are scheduled to be released from prison in the next 6 months and release them into home confinement. Criminals over the age of 65 should be granted parole, as underlying health issues mean mortality in the face of COVID-19. And copays should be suspended for prisoners when seeking medical services, as the average prisoner works for as little as $1 per day. If this feels out of reach for you, I ask that you consider donating any amount to the National Bail Fund Network that is currently raising money for bail funds across the country to help people pay for bail that they can't afford. Prisoners are still human beings, and they deserve the right to social distance and prioritize their health during times like these.